Hi, I'm here with Craig Peabody of Peabody Funeral Homes. Craig, tell me a bit about yourself.
Well, I'm a third generation funeral director. My grandfather started our business in 1933. Um, Myself and my brother are partners in business here in the communities of Derry, Londonderry, and surrounding communities. Again, we've been in business since 1933. And my wife works along with us. We have some great staff here, funeral directors that have been with us for 20 years and even up. And we enjoy trying to serve our community the best we can.
Craig, what does being a funeral director entail?
There are so many facets of what we do. Everything from the mundane gathering of information from family members on their loved ones, to preparing their loved ones for viewing, to conducting funeral memorial services, visitations. It's quite involved. No 2 days are the same, for sure.
Now, tell me, obviously your job is really emotionally challenging. How has COVID-19 affected that for you?
COVID-19 has brought new challenges to what we do, unlike anything that we could have prepared ourselves for. A lot of what we're doing today is remote. We do a lot of remote consults with families, everything from phone consults to email consults. We're doing a lot of things back and forth with our families, devoid of contact. Our offices are small, so currently we are limiting the number of people into our offices to make arrangements. Usually it's more phone consults, email back and forth. We have a full website with showcasing the services that we offer, our price list, merchandise that we offer, from caskets, vaults, urns, the ability for families to start the whole arrangement process with an online form that we have, which we call Arrange Now, which allows them to jump online and fill out a lot of background information that we require to kind of get the process started. It's changed things immensely for us. It's taken a little bit of the personal, tangible side of what we do. I'd say touchy-feely, but we are a group of people that like to embrace people and bring people in close to us and to do whatever we can to help them through this difficult time. This whole process of COVID and the pandemic has made that really difficult. Not being able to bring people in for an hour or two and have one-on-one communication back and forth where you can actually see people's emotion versus trying to read them through a phone conversation or an email conversation. So this has been huge for myself, my brother, and our funeral directors to try to navigate through this time in our lives that none of us could ever imagine. I never thought I'd have to do business like we do business today.
What type of effects do you feel that type of COVID-19 miscommunication, almost, where you can't bring people in, how do you feel that affects your clients?
Well, we've had different stages along the way. There was a time early on last year when we all were affected by the pandemic to begin with, where our governor was putting mandates on how many people could be in the building. And at one point we could only have 10 people in the building, and that even included clergy. So we found a lot of families that had, say, large families that wanted to get together as a family, even if it was to be private, couldn't even do that because their family might have been 25 or 40 people, and they weren't even able to assemble under a roof for a viewing or a memorial service or anything like that. Some families were opting for outdoor services, such as at the cemetery. But we even had cemeteries that were limiting the number of attendees there, even in an outdoor setting. So it's had a vast effect on our families, especially early on when our limitations were so severe. The limitations then bumped up to 25 people in the building. That loosened things up a little bit, made it a little bit easier, a little more receptive for families to consider having some services versus maybe selecting cremation or burial with a service at a later time, hoping that the pandemic would subside and families could get together safely. So it's changed things for families immensely. The last probably 6 or 7 months, maybe 6 months, the state is loosened up enough so that we can have 50% capacity in our buildings, as long as we socially distance. So we literally have tents of areas throughout our facilities. We have counters. We're keeping track of numbers of people in, numbers of people out. We have a certain number we can have in each building. And but that has opened it up huge for families that have been able to have both public and private services. I think one of the big effects on families too is the limited travel and the quarantining. So many families live across the country from one another. So to try to get families together, for this event has been immensely challenging. Families that can't come in and expected to quarantine because they came in from Florida and then get back to Florida and expected to quarantine again. I mean, who can take a month of their lives out of work so that they can quarantine to attend a loved one's funeral? That's been probably the most challenging thing for our families, is the inability to get together as a family. So yeah, it's just been a crazy time.
That's insane. I can't imagine like having a funeral and not being allowed to have family come,
Absolutely.
I mean, that's how do you feel? Have you seen how that's affected people?
Yeah, I mean, there's a lot of people out there that are not allowed to fully mourn or grieve the loss of a loved one because they haven't been able to go through the necessary steps. They may be able to get a couple of steps done, but they can't go through the whole process because they can't get the family together to have the memorial service or the funeral service. And it's been really, really trying on families. And a lot of them are putting it on hold. Some have put it on hold from last year in the springtime in hopes that they could do it maybe in the summertime, because nobody thought this was going to last as long as it has had. So, folks thought, well, all right, we'll have to wait maybe 2 or 3 months and then we'll have our get together. And they're still waiting, still waiting. So yeah, it's amazing how this has affected folks.
Now, one of the big kind of duties of being a funeral director is going to retrieve the bodies of people who have passed away.
Sure.
Have you had to retrieve bodies of anybody who may have been affected by COVID-19, and what sort of like precautions do you have to take compared to the norm?
Yeah, I'll say, unfortunately, we've had too many opportunities to bring COVID patients into our care in the last 10 or so months. Last year, especially in the months of April and May, were really bad, where New Hampshire nursing homes, unfortunately, were infested with COVID. And a lot of patients, a lot of nursing home patients lost their lives. So yes, we've had to bring people into our care from hospitals, nursing facilities, residences that have been COVID patients. And as far as PPE and procedural things to keep our staff safe, we've done nothing but jump through hoops since last March, trying to get a hold of every little bit of PPE we could. I mean, we always had gloves and aprons and goggles and things on in our facility, but we didn't have a stockade of N95 masks. And we are really frontline healthcare workers. We're going into these facilities just as a nurse or a physician or an EMT would. And so we scrambled. We scrambled for a couple of months. We bought more product than probably we will use for a very long time, but we didn't want to take any chances. And we knew we had to protect our staff. We have to make sure that when they go in, they have everything they need to stay safe. We can't afford an outbreak in the office. We can't afford staff members to have to quarantine. Our office is small. We're a small group of 5 directors. If one gets affected, we could all, in essence, become affected, and we could have to shut our office down, which, we're the only funeral home here in Derry, Londonderry. The community needs us. We need to be here to serve the needs of the community. We can't be out on quarantine for 2 weeks. It would be an awful situation. So yeah, we've really had to change the way we do things, change our procedures, and ramp the PPE up to a level that I never thought I'd have to do.
That brings up a good point too, that you guys are really kind of primary healthcare workers. Now, in recent days, the vaccine has been getting distributed out to nurses and people working on the front lines.
Sure.
Have you guys gotten that at all?
So yeah, actually, I'm happy to say I've already received my second vaccine. Our state board of funeral directors and embalmers really went to bat for us. We started early on, kind of nudging, poking the bear to say, hey, you know, you need to let the state know that we are frontline workers. We're out there with the EMTs and the nurses. We're the people that are showing up at the residence or the nursing home. We need protection. We need PPE if we can't get it. We need, and the state has helped. The state has helped us out on a few times where we've been a little low in certain areas of personal protective equipment. They've provided it for us free of charge. But the vaccine was the most important thing, and we were on them a little bit to say, hey, you got to push for us. We need to be covered. The legion of funeral directors out in the community is immensely important that we can continue to do our jobs. And so we need to be vaccinated. And we weren't the very first to get vaccinated. We ended up in, I think, tier 1A. But I had my first vaccine on New Year's Eve, and I received my second vaccine 2 weeks ago tomorrow. So feeling pretty good about that. And my staff likewise have followed suit. Everyone's trying to get on board and get vaccinated.
That's exciting. That's exciting. In an un-COVID related question, as a funeral director, how do you deal with seeing the loss of loved ones every day?
I would say to you that the importance of days off is crucial. I've been doing this for 35 years, and we've learned along the way the importance of time off for my brother, myself, and our staff, our directors. The importance to go home for a few days, spend some time with your family, recharge the batteries, because it is a very draining business, and we need to be able to give 110% all the time. People need to know they can count on us even when we're tired and weary. So days off are crucial, to take off for a few days with your family or friends and just decompress. And so in the last year has probably been, it's been the most challenging year by far in my 35 years. So time off, days off have been very much needed and appreciated. So I don't know how we do it if we had to just go 24/7 straight through. It's like anything, but it's a pretty demanding field. So
we're just about ready to wrap up here. Do you have any final thoughts before we finish up?
You know, I'm grateful that they've unveiled a vaccine in a really timely fashion. I think we're all hopeful that this vaccine will put us in a better place as we move forward. You know, I feel for all the families that have been able to honor their loved ones as they have wanted to do along the way. And yet of late, so many are finally able to. But I feel for those people that have held off in the past and again, through travel restrictions and so forth, haven't been able to bring their loved ones together. But I'm hopeful that this vaccine is going to turn things around. I'm hoping that more and more people will see the vaccine as a good thing. They won't run from it. Again, it's not a live or a dead virus that they're injecting. It's a protein. So we can only just cross our fingers and hope that more people will see the vaccine as a good thing and go out there and get vaccinated. And hopefully we can put this pandemic behind us.
Good advice. All right, we'll call it there. Everybody, this has been Craig Peabody. It's been a pleasure talking to you.
Yeah, Austin, thanks. I appreciate the opportunity to speak with you.